Welcome to the overview of the Protective Factors Survey for Prevent Child Abuse Iowa. My name is Darshana Spock. I'll be presenting for you today. I'm working for Hornby Zeller Associates, who's been hired to run the Protective Factors Survey for the state of Iowa and to give some technical support and some tips administering the Protective Factors Survey for your prevention programs. I'm going to be running through this brief presentation. If you have any questions at all, just let me know. I'll have some contact information at the end, but hopefully you'll get some useful information so that you can run your survey successfully this year. So you'll see on your screen, I'm sharing my desktop with you, and what you'll see is a slideshow here. Here we go. The slideshow right from the beginning, and so right now you should be seeing PCA Iowa Survey of Protective Factors, and there's my name, Donna Spock, in July 2012. A few goals for today. We're going to review the objectives for the survey. Why are we even administering a survey like this, and what do we hope to get out of it? I want to get you familiar with the tools available to you. There are a couple of different varieties for this survey. We've got a web-based survey and then some paper tools as well, and we'll help you figure out which one is right for your program. And we'll also talk a little bit about how and when to implement the surveys, and you know that there are always exceptions, so there are going to be special circumstances, and so far I've been communicating with a few programs who have different questions, or maybe their enrollment schedule is a little bit different or unusual, and that's fine. You can let me know as we go along what work for your program. I'm going to give a sample of what the results look like when we share them with you, and that can be helpful when you're looking for funding support or you're looking to advertise the benefits of your program, and also give you plenty of time at the end to answer questions and again give you that contact information. So basically, Hornby Zeller was hired to create a survey to measure the protective factors that can be used across all prevention programs. What we do have in common is that the goal is to reduce the incidence of child abuse and neglect and these protective factors in families. So we designed a tool that could measure the impact of your programs that are funded by Prevent Child Abuse Iowa. Then here we're going to go through your desired outcomes and the protective factor domains, which many of you are probably very familiar with. Let's click this. Here's a quick overview of the desired outcomes for this survey. As I said, you want to use a statewide approach to evaluate those prevention programs. We wanted to use the same variables across all program types. We've got education or parent development programs. We've got outreach and follow-up services, respite and crisis care, and then, of course, sexual abuse prevention programs, which are mainly geared toward working with children in school settings, and those children will not be asked to complete a survey, obviously. So right now we're going to not worry about including the child sexual abuse prevention programs, and the protective factor survey wouldn't really be the right tool for that. So using this survey, at the end of it all, you'll be able to describe the population that you served that year, and you'll be able to look at those demographics and see if it's the target population or if it's who had in mind for serving your different program types. You'll be able to look at the changes in family protective factors from pre-test to post-test. That's the technical term, but that means from the beginning of service involvement or at enrollment, and then following some sort of intervention or service that you provided. We'll look at the change there. And then you can think about which ones need more focus, or we want to develop your programming further, or look at your continuous quality improvement efforts. And you'll see that slide that says CQI, and many of you are probably familiar with that acronym. It's a common term that we use in evaluation. So you're always looking to change, and this is just one way to help you figure out where to direct your efforts. It helps you also comply with the state reporting requirements, and especially if you have a rule in home visiting, if you're using that grant that was offered from MIECHV, you might be responsible for working with very risk families or a certain population, and this will help you comply with that. Here's a brief overview of how to use the survey for continuous quality improvement. You get the bullets here, or the circles here on your screen, and you see that you administer the family survey. Then we compile the data for you, both from the web-based and the paper surveys that you enter. We analyze the data and clean it up and get it back to you so that you can look at the results and then use that information to inform change. Now just remember, this is one part of your assessment plan. You have other ways of knowing how you're impacting the community, but this survey should fit in with your larger plan here. We do provide agency-level feedback for programs that completed enough pre- and post-tests to combine. And I think originally we said we do that for 25 pre- and post-matched, but we'll just, we try to give everybody possible results. So even if you had fewer than that, you might see something come back, but what we try to do is maintain the integrity of the survey by making sure that what you're looking at is a fair representation of population served. So if you only get 5 surveys back and you serve 200 people, we don't want you to put a lot of stock into those 5 surveys. They're valuable, it's important, but we also put that text of what they really represent. Do those 5 surveys really represent that large population you serve? And the other thing is we like to maintain confidentiality, so we only report above a certain number. This shows you the protective factors domains. We've got on the right side the definition of each one, and maybe, as I said, you're familiar with those 5 protective factors. There could be others, you know, if we're looking at this list. We have family functioning and resilience. We often will see that term resilience listed family functioning. We've got social emotional support, and this is from the community to the family that you're saying. Support is about the basic needs or access to tangible goods, especially in times of high need or high stress. That's when there's child development and parenting, or knowledge of child development from a parent's perspective or the caregiver's perspective, and then nurturing and attachment, which is that emotional connection the parents have with children. What you see that's not here is anything that's related to adolescent emotional health or the child emotional health, which is also part of the protective factors right now, but that's not on this particular survey. Let's get familiar with the actual survey that's used in Iowa. We've been using the survey for the past year now, and so many of you, this will be review for you, but those of you that are new grantees or that are need to get familiar, hopefully this part I'll be able to show you exactly what you'll be looking at so that you're familiar with them. I'll give you some tips on how to administer the survey and when. And I guarantee you'll still have questions at the end because everybody has situations or individual things that come up, and that's totally fine. We'll work with you on that. So what on this slide is the survey sections. We've got the protective factors questions. There are 20 of them, and the reason, oops, let me go back here. You'll see the factor and the definition. In the middle is a number of questions that ask about that factor, and that's to increase the validity of the tool. So if you only asked one question about family functioning, it would not be as valid as if you asked and tested those 5 questions and looked at them all together. Same logic applies to the 4 factors there. So just a quick update there. The next section that you'll see is family information in question. Those are the basic demographics of the enrolled participants. They ask race, gender, household income, what their living situation is like, and so on. Basically the same thing that you see on the U.S. Census. Then there's a place for participants to tell us what services they actually accessed. It's totally up to them. If they decide to skip that section, it just means we won't be able to tell you what the trend was for those families. So I would encourage you to help them understand that all of their input, they're absolutely to skip the questions, but we like for them to fill that in so that you can get a complete picture of the families that took that survey and see if it makes sense to you. I'm going to provide an example of the survey here on my screen, so let me just click over. Is here. Okay, so now you can see the paper version of the Parent Development Survey. Remember I mentioned in the beginning that there are a couple of different types of surveys depending on your program type. Now, this one is parent development. The outreach and follow-up is similar, and then there's respite and crisis care. The respite and crisis care will have a couple of extra questions at the end asking the primary reason for accessing respite or crisis care. And we want to confuse the audience by asking people who came to home visiting why access respite and crisis care. That doesn't belong there. So we kept that off and took the time to create 3 versions of the survey that will fit. So here you can kind of see us scroll down all the questions and the demographic questions here. Again, I'll skip them, but we'd like to see them filled in if possible. And then I said the services, there they are. Those are the types of services they received. So at the top here, what's new this year is that we have one form, and we ask for the staff to fill in if this is an enrollment survey or a follow-up survey. And I'll get into that right away about which is which. But this is something that the staff can fill in prior to giving the survey out. This is something you don't have to worry about if you're completing the survey on the web, because the question is asked in a way that leads the participant to answer the correct survey without much work. I'll show you that next. Let me see here. Documents are available. Yes, those documents are available on the ICAPP website. I'm also going to show that to you. Let's here. This is the beginning of the survey. Here's Prevent Child Abuse Iowa website, and you'll see at the top a little brownish box that says grantee information. If you click on that box, you will hopefully see what you see. Okay, what you'll see is the ICAPP box, the bottom right left-hand corner, and you will select forms, and that's to the 2013 update forms, just like the one I just showed you. Scrolling down to the bottom, here we go. There's your reporting forms, and Kelly's going to give you an overview of your reporting requirements, but focus on the predictive factor survey. And here they are. It says FY 2013 predictive factor survey, and there are 3 versions. The Spanish versions will be posted really soon. I'll let you know when that happens, but they're not quite ready yet. Now, if you were one of those programs that participated in the predictive factor survey last year, please recycle those because we changed the form. Don't need them anymore. So I want you to update your forms and use the 2013 version. Thank you very much in advance for doing that. It's important to attend to that detail. Let's get back to the slideshow here. Now, 2 options for completing the survey. Families can access the web survey at any time at iowafamilysurvey.org. There's an address, nice and big for you there. Same exact address as last year. The updates have been from our end, and they can go right on and flow through the survey. I'm going to show you that next. The paper copies can be made in advance. You give the hard copy to the family, they turn it into you or put it in a special box, and then your data entry person can put that in. And that I think we annual report of the predictive factor survey, and if you ever need something in the interim, you let us know. Like we do give PCA Iowa some data as requested during the year, but you might have some different needs, but you can always contact us and we'll let you know if we can get that for you. 2 versions. Let's see. Now to the web-based version. Plugged in here to the Iowa Family Survey. This is a long URL, but the part is the iowafamilysurvey.org. You won't need to worry about telling the families this whole address. Just tell them iowafamilysurvey.org. And those data entry people out there, that's what you're going to put into. So it's English or Spanish, and hit continue. And the family will select the county the service is. So these will be updated for next year. This is our last year's list. So if you're not here, don't worry. if you don't see it on the screen, but you scroll along and choose the program where your program is, and you hit continue. And then under the program list, there are only programs that are available in that county. So you won't see respite care if there's not respite care offered. So that reduces the error from the user side as well. So let's say if I'm in a parent education group and I've been involved in the program less than a month, I select that. That's the pre-test or the enrollment survey. And if I've been involved for longer than 6 months, or I'm leaving the program or I'm done, then I would select that, and that's the post-test. And once I hit continue, that will bring you right into the proper survey. Give a little overview here of why we're asking these questions and how we're going to protect them for you, for the families actually. And we ask them to go through and fill in these questions. And I'm going to go and just toggle through so I can show you what those protective factors questions look like. Random dates, and this will all be wiped out, so we don't need to worry about that. Okay, the protective factors questions, they look just like the paper version. Here they are. In my family, we talk about problems. In my family, we talk about problems. Same thing. So that shouldn't be a problem for your data entry people, and it shouldn't be a problem for families who are used to taking line surveys. They just hit one of the buttons and move along. We do have a skip column at the end, so it's really helpful too. If they decide they don't feel comfortable answering the question, that's fine. So that's what the survey looks like. We'll go back to the PowerPoint here. Implementing the survey, some useful tips, and where to go for help. It'll all be pretty easy once we get to the end of the day, but you'll still have questions. So we have an enrollment survey and the follow-up survey. Just remember, it's the same form that you check the box off at the top. The enrolled version goes to families enrolling in, participating in the first and 3 months. If you missed the opportunity to survey a family and they've been enrolled for a relatively short amount of time, we're going to say we'll draw the line at 3 months. Other than that, they would be eligible for an enrollment survey. On here it says less than 1 month, but what I've learned since putting this show together is that sometimes you have drop-in services or families are really coming in infrequently, so we stretch it to about 3 months. The follow-up survey is done at program completion or after 6 months, whichever comes first. So what I'm trying to say with that is if a participant is going to leave your program before it's time for you to administer the survey, offer them the opportunity to complete a survey, kind of an exit interview for you. So it's okay if they leave the program before your time. You can either hold on to it or data enter it, or if they use the web version, they can go in at any time and a date is saved on the back end. So we can sort by date. You don't need to worry about setting up your data from year to year. Those will be sorted out for you. Another good thing about the web version of the survey is that participants can feel comfortable answering the questions at a place that's comfortable for them. They don't have to worry about, or you don't have to worry about postage. You also don't have to worry about data entry. But it's a fact of life and is part of our work. So that if they do use paper options, if they don't have computer access, that is completely fine. You to decide which is best for your families, and only you will know that. The other, I want to talk, let's see, there's something else here. Oh, what new this year is last year, guided to only offer surveys to families that were enrolling in 2012. What we could do this year is to get more surveys in and look at the results across a larger group of people, is to offer the survey to anybody that qualifies in either the enrollment category or follow-up category. And remember that what that means is in the program for after 6 months and they never had an enrollment survey, you can still offer them a follow-up survey because we're looking at a group of families who've completed a survey in the past 6 months. If you've been in the program for more than 6 months and who did not complete an enrollment survey, it is okay to give them a follow-up survey. Okay, if you have questions about that, please let me know or let Kelly know. So here's the title on the next slide here, and as I breezed through before, we talked about the different program types offered through Prevent Child Abuse Iowa. We've got outreach follow-up, parent development, invested, or crisis nurseries. And again, we're excluding sexual abuse prevention programs for this projected factor survey. The best way to get the families with least complication. We want to make sure that we don't overwhelm families with the number of surveys that they're asked to do these days. So think about how you can distribute the survey as part of your regular paperwork. Do enrollment paperwork, put in that enrollment survey, look at so that it's completed before they access services. Or you can do a little half sheet with the website information and say, you know, families are starting our program to complete a brief survey. You can go in at any time and let me know if you have any trouble. Another thing that people do is provide computers or open up a computer lab and offer that as a choice for families who might not have computer access. So a good idea to offer childcare if possible. Give families a minute to respond without the distraction of their children, and I definitely understand when that's not possible. A couple of ideas here on this slide for new families. It says distribute as part of the enrollment process, provide the website information, like I said, on a half sheet of paper, a little postcard, and then think about this way you reach your families in your program. So if it is a festive event, you want to have a survey table and maybe a special drawing, that would be a good incentive. Or you say, we want you to complete a survey, and then everybody who completes a survey will be entered in to win a prize. I've seen programs do that. Cards, they go a long way, and you know, small tokens of appreciation for taking time to complete a survey. It's a good way to make it a positive experience and not make them like just something that you want them to go through the motions of doing, but rather you want to hear their feedback and you want to hear what they have to say. So it's really all in the delivery and all in the setup and the preparation. At the bottom there you see set up the environment. I put a bullet that says collection box or similar to maintain confidentiality. I think it's important for families to feel like you're taking good care of this information that they've decided to share. While it might not seem so serious to you or to us, we are asking them what their life is like and what their parenting skills are like. There are questions that are really uncomfortable, like my child misbehaves just to upset me, or sometimes I don't know what to do as a parent. And that's really personal information, so we want to demonstrate to the family that you're making confidentiality and treating their answers with respect there by keeping it put in display for everybody. It was a handout that we developed for last year, and it's a little bit of 2 words on a small page, but it gives you a good overview of when you give out the survey. So if you're looking at that enrollment version for the follow-up version and you're confused about who gets what, you can look on a slide, and this slideshow will be available to you after following this presentation as well. But it's just in case you're sharing this information with other staff people that are not able to be with us today, that'd be helpful. But it's basically a repeat of what I've explained at enrollment or after 6 months, whichever comes first, and ensure that you enter that in at by the last day of every month so that it gets counted properly in the fiscal year. So good. So we've got some best practices and tips, and in your regional meetings and in your supervision sessions, you can come up with your own best practices and tips. For sure, the more brains that involved in a system, the more, the ideas we come up with. But we've just bulleted a few key points here, and definitely rely on each other for your expertise and make things as simple as possible. That's what I think. And in this work, you do a lot of paperwork. You have a lot to keep track of. So just rely on each other for that expertise. But a few best practices and tips here. So remind families of the importance of honest feedback and let them know that their answers don't impact the services they're going to receive. That you really want to hear what they have to say, but you're still going to do a good job and still work with them where they are. So they'll be threatened or like there will be any repercussion to them being honest. Remember that survey is kept confidential. And again, there's that idea to put it in a designated location or give them a sealed envelope to return it in. What do you need to do so that they feel protected there? Assure families that's going to be a staff person responsible for data entry might be tricky in home visiting. For example, a visitor is giving out a survey and then taking it back with them. You might want to make a point of putting that survey away and say, I'm going to bring this to the data entry person and we're going to take good care of it and thank you very much. But on side of it, assigning one staff person also keeps the data entry clear and it reduces the incidence of human error. Of course, even when you have an expert working a still opportunity to make mistakes. We all make mistakes, but if you assign somebody and you train them on data entry, it can definitely help you with that. It reduces that opportunity for mistakes to happen and the accuracy of the survey. And develop a system that will work for you in following up with families. So you can figure out from a maybe shared calendar, or you can indicate when the survey is due by noting it in the family's file. If you have, I've seen things like an enrollment roster where you have the date of enrollment, the family's birth date, or whatever number you need, and then have date initial survey given, date follow-up survey due, and then a little checkbox available, and then you can see. So you'll come up with your own system. Again, if you need help figuring something out, you can let me know. I'm here to help you with that and give you some good ideas. But you have to figure out what system will work for you in your paperwork. Materials well ahead of time will help in catching people when they're in a hurry. It's not that effective to try to give a family a survey as they're rushing out the door with a baby and a toddler running away from them. You want to be well aware of the situation for families and catch them at the opportune time. Again, child care offer is really a good one in terms of helping families their paperwork done for you. Whenever possible, I would suggest using the web. That really reduces the amount of work you have to do. It's faster. It's just people are more and more used to using waste. It's not on here, but another best practice or another tip I could give you is if you are using paper copies and you see top of that survey, you'll see there's enrollment date, there's county, zip code, program name, and then the enrollment and follow-up box at the top. As a staff person and you're arranging to give out the survey, go ahead and fill in all of that information you can. Just leave out the space for their first and last initials, and don't write their names on it because we don't want to see their full names. Give them confidentiality there. And they can fill in the county where your program is, the zip code. If you know they're participating with the survey through one program, you can fill that in. And it would be really helpful if you could pre-fill their enrollment date if you're handing it to an individual, because they may not know their exact enrollment date. So pre-filling any of that stuff would be really helpful. Otherwise, if you can eating it out at a festive event or you're handing it to a group of people, you can fill in the basics like program name, county, zip code, make your photocopies, and they can go from there. So that that really still data complete, the better. Okay, so now we're going to talk a little bit about how you can use the data that comes out of this survey and what you can do results. And these are just examples, but some areas of interest for you might be about the demographics. So you might want to know how many families are struggling with their living situation. What is their housing situation like? Are they living in poverty? Are they gainfully employed? Are they going to school? And those are the points that you can get from this survey because we asked those questions. You want to know the number of families served and how old their children are. You want to know the ages of children in the household. All of that can be done if they fill in the survey properly. And if you're interested in the actual protective factors questions, you can look at the change in the protective factor. You can look at the thing of, so if people are rating themselves really highly at the beginning, that's showing a lot of confidence, also showing that maybe they don't know what they don't know yet about that protective factor. Like child development is a really common one where parents might rate themselves very highly because they think they know a lot about children and child development, but then once they become involved with a program that, like ones that you offer, they might realize how much there is to learn, and then the score can actually go down, and we see that all the time. And that's not a bad thing, it just is a reality, and it's something to pay attention to. You plan programs and activities that are specifically designated toward one area. So if you have families that are struggling with little support or concrete support, you might want to arrange for an event or an extra service or apply for grant funding to support that area of concern that you have, if possible. You might want to rely on other aides that you network with in the community to provide services. The other thing that you can really see from those protective factors questions is how families rate themselves. What they're saying about their own parenting abilities, about their understanding of development, and where they are with their rearing and their families. Of these, the demographic information and the protective factors questions, what we do from our end is look at the demographics and the protective factors with cross tabs. That's a way of saying we look at how certain demographics different outcomes with protective factor. So looked at, say, the of your program on income factors in different families by education or by income level. You can look at that from this survey. Just a basic chart, and you can base this one says family structure of the people you serve, but you could also put in household income of the people you serve, education level of the people you serve, and then we use the pie chart when we're representing the whole and the total to 100%. But in this chart, you could see that if even a quick glance that most people were married, and then by 30% who are a partner not officially married but maybe living with somebody. So that's those basics. And get a little more involved here by looking at average scores of protective factors. So as an example of all 5 protective factors in one bar chart, the range of score is from 1 to 7, 7 being the highest possible. So like the most positive rating would be a 6 or 7. 4 or 5 would be about the middle. 1 very low rating. So maybe the types of responses are strongly disagree or never. Those types of would be considered as a 1 or a 2. And you can see from this fictitious data that nobody scored below a 3.5. You can also see pretty quickly that concrete support, just at quick glance, that concrete support is the lowest word predictor at pretest, and at post-test it goes up to 5. 5 is not a terrible score, but you can see that others go up quite a bit further. Math is the highest score, and then you can see that that's in the area of child development. So that's kind of fun to look at, especially if what your program's priorities are, and you say, well, we offer a parent support group that offers child development and how to connect with your child, and then you're going to be really interested in that nurturing and attachment score. What did families have to say about how they felt about nurturing and attachment after receiving a service? Well, gee, they started with us. If you see themselves as a 6 out of 7, after with us, the score declined. That's a negative, not necessarily a negative reflection on your programming, but like we discussed before, it could be that they didn't know what they didn't know until they worked with you on that. So that's just a couple of ways to look at pre-test versus post-test scores, and we do the best we can to match those, but that when that has to catch the same families at pre-test and post-test, and we try to do that. So here's another way to look at the data. Same 5 protective factors. Now, if we're looking at an example of the percent of respondents who improved, stayed the same, or got worse from pre-test to post-test. So now we're just looking at overall percentages here. So quickly you can see, well, nurturing and attachment, again, that same number, and they're pretend again, but looking at it a different way, we can see that 90% of the participants felt that they improved. Really commendable, not far behind 89% child development. Then if you want to pick on something, you want to say, oh, wow, 32% of the people said they did the same in their family functioning. Well, you have to look back at those family functioning questions and consider, were priorities for us? Was that something that we intended to address, or is it okay for us that we stayed the same in family functioning? Since, again, you can pick apart data that way and get it applicable to your questions that you are asking about your services. Results make service useful to you. You want to make that connection between what you're doing with your program, what intentions are, and the outcomes for children and families. And you want to be able to demonstrate that to the general public. You do that by inserting these types of tips and visuals into written materials, like when you're producing a report or when you're doing a presentation to a community. You might also have to do that anyway when grant requires you to do so. ICAPP requires you to fill out outcomes data, and maybe if you're early childhood advisory council, who it is, you have the opportunity to use this data once you get it back and back to the public that it pertains to. So look, the other part about looking at these results, it actually allows you to consider your impact in the community and look at areas of interest and what are you doing with your programming and what kind of efforts are creating responses or best outcomes for children and families. That last bullet probably is the most important for me, and that's understanding the connection between your work and the outcomes. So are you doing what you said you would do? Or you intended to do, rather. Our quick recap, that's a good sign. That means we're getting to the end here of this quick overview of the Protective Survey. So just to review, at enrollment, you can start using that web-based survey. It's July 2012. We have a couple of edits, and they'll be available for you very shortly. We're also making sure that the Spanish edits are working properly too. At survey, the enrollment version is for new enrolling families or those who've been involved for ideally less than 30 days, but remember in the beginning I said if you have a family involved for up to 3 months and you hadn't seen them very often, you offer them that enrollment survey. And then you continue offering the survey to any enrolling family throughout the year. So if they miss the survey time or the year cutoff, you might have to offer them a survey this year. But without confusing you, not everybody enrollment survey if they've been involved in your program already. So then the follow-up survey is administered when a family has been involved for at least 6 months. So the follow-up surveys are done, and remember that if the survey wasn't completed, that they can still take a follow-up survey. And both of them look the same now. You just have to make sure you check off the right box at the top. And if it's on the web, you're not going to worry about which survey they take because the question will guide them to the right survey, either pre-test or post-test. So time for some questions, and we will also be posting those questions in a Q&A format, probably through a PDF document. This is what we did this year. It seemed to work okay. Also the contact information, and right there on the screen is my name, our direct phone line, and my email address for you. Tweed is our information technology manager, and he may also be the friendly voice on the other end of the help desk line. It's a mailing address there for you, but generally you'll be collecting the surveys and entering them on site. And, but we are in South Portland, Maine. You're curious about where I'm calling you from. And I think that is all for now. So now your screen goes black. I'm going to go back to Cloud. I'm going to close out of the survey. Prevent Child Abuse Iowa website, and this is where the presentation will be posted for you when it gets cleaned up and ready for listening. Thanks for your time today, and if you have any questions, don't hesitate to call me, send me an email message.